Good afternoon, Sandeep. Best of luck.
Good afternoon, Neeta teacher. Thank you.
Very good afternoon to all of you.
Good afternoon, sir.
Good afternoon.
Good afternoon, sir.
Good afternoon. Good afternoon.
Okay, Sandeep ma'am, now you can start because I think more than 40 teachers already joined. You can start, ma'am.
Okay, Arvind, sir. Good afternoon to all the teachers present here. The topic for today is Health Promoting School. The topic Health Promoting School itself defines its objective. So, under this topic, we are going to learn how we can make every school a health promoting school, how schools can help the kids with promoting of their health, how school plays a vital role in the well-being of the children. Now I am going to start presenting my screen. In this slide, we can see few images, and these images are really heartbreaking. Can you recall the time when we faced these situations? Teachers, can you recall the time when we faced this situation? Please reply in the chat box. Can you recall the situation when we faced this? Yes, it was COVID time. Thank you, Shalini teacher. So the coronavirus pandemic has reached almost every country in the world. Despite the development of vaccine, many are still wondering what recovery would look like. This was the time when people lost their loved ones and their jobs. They were striving for food and life. We have seen bodies burning on mass funeral pyres, stories about hospital packed beyond capacity, and desperate plea on social media for oxygen. All these situations has taught us a lesson. You can tell me what you learned from the situations of COVID-19. This situation has taught us a lesson. Teachers, please tell me what you learned from this situation. Reply in the chat box what we learned. The situation taught us a great lesson. Yes, staying safe is important. Health is wealth. Okay. Yes. So we should consider health as our priority. And this is the thing where we lack this time. Like in the long term, India health system requires a massive overhaul, which would require significant financial investment. The low quality of public health services need to be addressed to prevent resurgence of virus or future pandemic, and for this we have to invest more in the hospitals and schools so that we can provide more of health education at schools, and we can come through this pandemic situations. So let's move forward. Now, around the world, schools plays a vital role in the well-being of students, families, and their broader communities. I hope you all agree with me that school plays a very important role in our lives. And the closure of many schools during COVID-19 pandemic has caused severe disruption to education, caused an estimated 365 million primary school students to go without school meals, significantly increased a rate of stress, anxiety, and other mental health issues. Past experience also tells us that in some part of the world, when school close for more than few weeks, there are increase in early and forced marriage, early pregnancy, and domestic violence. So we all have seen, even in our school, also that many of the students were deprived of education because of the financial crisis, or a lot of finance has been invested in health, due to which they were unable to give the fee, and they have to leave the school, or they have to be out of this education system. So the COVID-19 changed the scenario, the whole scenario for the kids and the school. The right to education and the right to health are core human rights and essential to social economic development. Now, more than ever, it is important to make all school plays that promote, protect, and nurture health, and that contribute to well being, life skills, cognitive and social emotional skills, and healthy lifestyles in safe learning environment. See, the kids have not come to school since 2 years, and when they will come back to school after 2 years, it will be hard for them to adjust in this environment. So we have to take care of these things, that they get a protective environment, a good health, well-being. They have more of cognitive skills are built in the school, like thinking, reasoning, and remembering, so that they get adjusted to the environment as fast as possible, and we are back with the same life that we used to live before. Now, the idea of health promoting school was articulated by WHO, that is World Health Organization, UNESCO, that is United Nations Educational, Scientific and Cultural Organization, and UNICEF, the United Nations International Children Emergency Fund, in 1995. It was articulated in the year 1995. Now, before learning what are health promoting school, we will see what health promoting education system is. What is health promoting education system? system. The first is invest in leadership for school health. When we are formulating any policies or any plan, it is very important to have a leader. Doing so will help us to coach, manage, and set goals and provide effective feedback for each of the team member. Because if the leader is there, he will provide a plan and then an effective feedback for all the members in the team. This in turn encourages professional development for the entire team instead of just a few of the motivated individuals in the management position. So it is very important to have a leader at top to get this education system work. Next is make core budget allocation for health promotion and education. Now, budget is also a very important factor. Budgeting is the important as this is a formal way of communicating, planning, objectives and budget goals to various responsibility centers. Like if we have started working with a plan at school, first we will choose a leader and for then we have to allocate a budget. Budget allocation is necessary. For that, the formal communication is to be done to the various responsibility centers. Now, who is the responsibility center person who is in charge of operation to be taken at higher level? So therefore, it helps in communicating the plans of the schools and the means to achieve them to the concerned person. So it is very important that after making a plan and getting a leader, the plan should be communicated to the concerned person at the higher level. So the budget allocation can be done. The next is promotes health and well-being in the curriculum and teaching method. Now, first let us discuss what is curriculum. Can you all tell me what is curriculum? What is curriculum? What is curriculum? You can unmute yourself. Teachers, what is curriculum? You can type in the chat box. Yes, whatever we are learning inside and outside the four boundaries walls of the classroom. Okay. Anything else? Curriculum. Thank you, Shalini. Okay, we can also say whatever is the content of the course that we are studying in the school is called as curriculum. Okay, so in our curriculum, we need to have some health education periods in our curriculum. Or we can plan some activities. For example, we can hold an activity fair showcasing the clubs and the teams that are there in our school. That will encourage us or the activities fair that we are organizing and discover new things to do at schools and ways to meet new friends. When they will meet their friends, this is an opportunity for both the teachers and the students as well. Because when we are meeting our mates, this will help us in discovering new things to do at the school. As we can say, connection support enrich us every day. So take the time to get to know your mates. So these can be an effective measures to promote health and well-being in the curriculum and teaching method. trains teachers and staff at all level on students' development and health and well-being. Now this is also an important thing. Like now as this platform has been chosen by CBSE for training of the teacher, this is very important because trained teachers develop better organization and planning. Professional development training can help teacher to become better at planning their time and staying organized. This ultimately makes teachers to focus more on the students rather than doing paperwork. Like when the teacher enters the classroom, if she is organized and planned, she can plan some physical activities at the first for the first 10 minutes of their class, and then she can start with her lesson. So it is very important for teachers to organize or plan their class in such a way that she is including even the health promoting exercises in the beginning, and the class is enjoyed by the students. If the teacher is organized and planned, the students will also enjoy the class. And the last point is includes health and well-being in its measure of success. Well-being is fundamental to our health, means it's a basic step of our health and overall happiness. Having a strong and well adapted sense of well being can help us overcome difficulties, helps us achieve our goals in life. In short, having high level of well-being help us to be the best version of ourselves. So, well-being is very important factors of health promoting education system. Now, let us see what are health promoting schools. The definition of health promoting school is a health promoting school makes a constant and consistent effort to ensure a safe and healthy setting for teaching. Teaching is for teachers, learning for students, and working for both teachers and students as well as for the community. So it not only works for only students or only teachers, it works for all. It includes all teachers, parents, students, and the community. The health promoting schools makes a constant and consistent efforts to ensure a safe and healthy setting for teaching, learning, and working. Now, what is a health promoting schools? Global standards identified 8 key elements of health promoting school. Now, the first element is government policies and resources. For moving to any step, the support of government is very much needed. So, it is very important for government to regulate policies and resources for promoting health in schools. Has directed many policies and programs to integrate health deep within the school activities. Example like providing of midday meals for the better health at school. School health promotion is an international need with programs implementing across continents due to numerous documents benefit to not just the individual but to the whole community. As I told before, it is not about an individual, it is about the whole community. So many of the programs are being promoted for the community. Simple teachings like teaching about hand hygiene, wearing mask. If I take the example of COVID-19, the government took a small step of declining the impact of COVID-19 on the people by by giving advertisements on the TV for washing your hands, wearing mask, or maintaining social distance, and a recording is also there for is being set as a caller tune. When we call someone, we get a recording. That also is a step taken by government to make us remember the protocols of COVID-19. So these small steps taken by government can help us in reducing the effect of the pandemics, or can help us in improving our health. So it is very urgent need of developing a model for health promotion at school that is replicable, sustainable, and can be modified to the local needs as well. Now, the next point is social policies and resources. School can lay down some policies for promoting health in school, like bringing of healthy lunch boxes, banning use of plastic, students' discipline, etc. School can use their resources to sponsor professional health programs. They can conduct some professional conferences or workshop. Trained teachers can be kept for coaching of the kids or mentoring of the students. This will help them to get better knowledge about the health, and school can use its resources in well and planned manner. The third point is school governance and leadership. Leadership and governance provides a developing plan developed collaboratively by the stakeholders of the school. Now, who are the stakeholders of the school? The stakeholders of the schools are the teachers, the students, the parents, the community, the other social groups, uh, are the stakeholders for the school. A leadership network facilitates communication between among the school and community. Leader for informed decision. So there it is very much needed in between the school. There must be a communication in between the school and the community leader, so that more informed decisions can be taken, and the solving of school community wide learning problems. And next point is school and community partnership. School and community partnership. What do we mean by this? These are the relationship that school form with outside organizations. It can be an NGO to provide programs or services that supplement students' schools experience. Partnership between school and community groups offer clear benefits to the school as well as to the community. They enhance learning opportunities by providing students with resources, experiences, and environment. If we see the Tata groups organize many fairs and many exhibitions, and our school is participating in that, so it helps our school also, and those fairs are helping the community also. The next is school curriculum, fifth point, and school social emotional environment, school physical environment, school health services. We will see, we will learn this in detail in our next slides. Point number 5, 6, 7, and 8 we will discuss in our next slide. Now see, health promoting schools have many features or elements, you can say, like social environment, physical environment, health services, health policies, community links, individual skills, and action competence. And these elements are divided into 4 key elements. The first is environment, that is physical and social. The second is curriculum and learning. The third is policy and planning. And the fourth is partnership. Now, the environment is divided into 2 parts, that is social environment and physical environment. Now, what is social environment? The school's social environment refers to the quality of relationship among the teachers, the students, the other staffs, It includes well being, safety, inclusion, and diversity, as well as social media and virtual settings. Now, the next environment, that is physical environment. Under this, it covers school building and improving the design, air quality, noise, light, or temperature of an existing building or classroom. So in this slide, you can see under social, we are covering staff relationship, the relationship between the staffs, students relations. We have to work with the relation in between the students, student and staff relation, staff and principal relation, parent and guardian. So parents and guardians are also covered under social environment. Next is physical. That it should be warm, safe for the kids, well kept. It should be kept properly. It should be clean and tidy, and planting of more and more trees in the campus. So plants and trees. So these are the two types of environment: social and physical. And the next element is curriculum and learning. Now, how health is addressed across the curriculum? The first point is SPHE, that is social, personal, and health education, which provides particular opportunities to foster the personal development, health, and well being of a child, and to help him, her create and maintain supportive relationship and become an active and responsible citizen in the society. We can teach them how to be calm, how to be confident. So this comes under SPHE. The next is PE, that is physical education. Physical education is for children from junior infants to sixth class. The curriculum contributes to children's overall development by helping them to live full, active, and healthy lives. It includes six strands, that are athletics, that you can include running, jogging. Next is dance, then is gymnastic, games, outdoor and adventure activities. So these all things comes under physical education. The next is religious education. Religious education is an essential part of education for students as it opens their minds to different beliefs and mindsets. So, nowadays, religious education is also very important. Mindset that different people and culture have around the world. It's extremely important for students to understand their worldview is one of many. Learning about different religion. Please mute your mic. Please mute your microphone. Okay. Learning about different religion can help students to find purpose with their own lives and can provide with their I'm so sorry, and can provide the opportunity to explore different religions and find meaning in things that they may not have found meaning in before. So, when they come to know about different religions, they come to explore many new things that they have not found meaning in before. The next is home economics. Home economics, everyone know about this. It teaches about us the skills such as cooking, sewing, which are useful in the home classes, in the family, and consumer science. Now, home science has been changed to stressing the entrepreneurial over the domestic. And the last one is science and biology. The science is knowledge about the physical and natural laws. And the next element is policy and planning. Now, policy and planning includes formation, implementation, and regular review of health related policies and practices. These health related policies are developed and implemented in accordance with the school aims, philosophy, vision, and ethos. Now, policies have five disciplines. First is healthy eating policies. It includes indulging healthy eating habits in the children, like as I have told before, bringing of healthy tiffins, banning the use of plastic. So these are the healthy eating policies. The next one is physical activity policies. Introducing of physical activities like six trains we discussed now that can be included in this. The third one is code of behavior. Code of behavior is the set of programs, practices, and procedures that together work for the school's plan for helping students in the school to behave well and learn well. It helps teachers, other members like staff, students, and parents to work together for happy, effective, and safe school. So it in total it talks about working off together for achievement of a happy, effective, and safe school. And the next is relative standard error. It is a statistical term in which a survey is conducted and a standard error of a survey is estimated from before itself. And then it is divided with the survey estimate and multiplied by 100. It is a superior method of presenting statistical confidence. The last is acceptable use policy. It is a policy which governs students' use of the internet at school and covers a wide range of issues surrounding the rights, responsibilities, and privileges as well as. Each school generally has a unique policy document which is drawn by teachers in conjunction with management and includes consultations with other stakeholders like students and parents. It feeds into and indeed governs a school's overall ICT policies and should be linked to the school's bullying and child protection policies. Now, how these five disciplines can be out can be helpful for the community. We can see school as a role model for community on social, cultural, and environmental issues. Community education, it will help in education of the community. Social networking, when we are having some seminars or some social work we are doing, then we are having building a social networking with the people, interagency coordination and support, close link with community programs. Participation is meaningful community programs. We can participate in meaningful community programs, as I took example for like Tata Groups organizing drawing competitions, fancy dress, or other schools. When we go to other schools for some competition, we can take part in those programs. And next is administrative support and policy formulation. So the vision and mission of the school should be very clear. Management support and participation to apply these five disciplines. The support of management and its participation is very important. Standard operating procedures for health promotion, behavior policies, equity, resourcing, preventing healthcare policies, emergency protocols, disaster management, canteens, because canteens are socially responsible outlets, so we should take care of canteens also. Guidelines for schools calendar transport, and the most important, safety and security policies. Safety and security is the must. Now you can see healthy workplace is equals to a happy workplace. If the workplace is healthy, we have a happy workplace. Now, the next is policy and planning. Under policy, under we have already discussed about policy and planning. Under policies and planning, we can see the following points: code of behavior. We have discussed code of behavior. Next is anti-bullying. Now, what is anti-bullying? Anti-bullying, we can see the suicide rate is increasing in kids in our society. One of the reason in this can be considered as bullying of kids at school. Therefore, the policy's aims of the anti-bullying policy is to ensure that people learn in supportive, caring, and safe environment without the fear of being bullied. And the next is child protection. The school should not use any form of corporal punishment on children, establish an environment that fosters the development of child through your actions and words. Do not place a child at risk of harm or abuse, and do not harm or abuse any child physically, emotionally, or sexually. Now, the next is substance use. The critical incidence is to intend to provide framework for the responses and management of critical incidents. Now, what is substance use? Like students using drugs or smoking in the school, bringing cell phone to the school. These should be banned. We should take care of these things. And the next point is critical incidents. The critical incidents policy is intended to provide a framework for the responses to and management of critical incidents that pertain to domestic and international students studying with academic of interactive entertainment issues such as domestic violence, sexual assault, drugs or alcohol abuse. Next is whole school guidance plan. A proper policy should be made to guide or execute a plan. SPHC plan, we have already discussed this. So these are some points that comes under policies and planning. We should take care about them. Next is partnership, family and community links. Who comes under the partnership? Parents and guardians, voluntary sports, art groups. The sports and art groups, those are there, can be considered as a partnership or the stakeholders. State agencies, those who are helping the school with formulations of policies. State agencies, community groups, and support services from wherever we are getting the support can be considered as the partners at the schools. Now, let us see what are the aims of health promoting schools. Foster the, foster the healthy development of the whole school community, provide a framework for developing health promotion initiatives in a way that supports and enhances the implementation of the curriculum, support the planning, implementation, and evaluation of health related activities under the school development planning process, enhance the links between schools and their communities. So, these are the aims of health promoting schools. We have discussed this before also. Now, what all things a health promoting school can help have? It should have a clean water supply, clean toilets for girls and boys, inclusivity. Now, what is inclusivity? The practice or policy of providing equal access and opportunities for and resources for people who might otherwise be excluded or marginalized, such as those having physical or mental disabilities or belonging to other minority groups. Next is students friendly furniture and equipment, safe labs, clean gardens and grounds, canteens as socially responsible outlets, eco friendly practices like planting of trees, safe and secure environment free from physical risk, school culture, positive and non threatening, introduction of life skills, value education, school health program, gender sensitivity, sport integration of visual and performing arts, art education, environmental friendly practices, encouragement for collaboration and group work, activities that promotes higher order thinking, activity that encourages exploration, discovery, experiential learning, inquiry, etc., and cater to recommendation of NCF. Now, what are the benefits of having a health promoting school? It will come like better learning outcomes for people, improved staff well-being, more coordinated approach to social, physical, and environmental need, increased pupil esteem, lowered incidence of bullying, safe and more secure school environment, better understanding of schools' health aims, improved relationships within the schools, increased involvement of parents and guardians. So, these are some of the benefits of health promoting schools. Now, whatever we have learned in the slides, we will just once go through it and then we will move to the next topic. Like a health promoting school, I am revising this, encourages the development of health and learning with all the measures at its disposal, engages health and education officials, teachers, teachers union, student, parents, health providers and community leaders in effort to make the school a healthy place, strives to provide a healthy environment, school health education, and school health services, along with school community projects and outreach health promotion programs for staff, nutrition and food safety programs, opportunities for physical education and recreation, and programs for counseling and social supports and mental support. So these are few examples given in the third point. So we can go through these examples and we can formulate new policies and program for developing our school as a health promoting school. The fourth point is implement policies and practices that respect an individual well-being and dignity, provide multiple opportunities for success and acknowledge good effort and intention as well as personal achievements, strives to improve the health of school, personnel, families, and community members, as well as pupils, and work with community leaders to help them understand how community contributes on to or undermines the health education. Now, in this slide, we will discuss what can a principal do to make every school a health promoting school? Like it can involve students, teachers, parents, and local community in developing and reviewing the school's health promotion plans. So, teachers, parents, and community members should be involved in promotion plans, support teachers and other school staffs to access resources and professional trainings in health education. More and more of trainings should be given in regards with health promotion, and the access to the resources should be available to all. Mobilize resources to support health promoting activities, like whatever resources that are available with the schools should be provided for promoting or supporting the health promoting activities. Liaise with local authorities, working with local authorities and health facilities to ensure access to child friendly healthy services for children. Last is internalize national or global standards of health promoting schools. Now, what can a student do? In the last slide, we saw what can a principal do to make our school a health promoting school. Now, in this slide, we will learn how can a student help us in making our school a health promoting school. A student can help us in the following ways: by learning how to keep healthy and happy and ask your teachers about it. Teachers can play a very important role in this by helping the students to by telling them how to be healthy, how to be happy, how to be calm, how to be confident. This will help a child in making our school a health promoting school. Stand up against all form of bullying and discrimination. Again, here also teachers plays a important role. We can start with some new sessions in which we are teaching students anti-bullying or discrimination. We have started also in from standard 4 to 8, so it can be continued further so that students can stand up against all forms of bullying and discriminations that are happening there with them at school or at their home. Next is encourages all people around you to live healthy. We should teach them healthy habits and encourage them to teach the same to the community when they are going out of the school. This will help us to keep our school healthy as well as our society healthy. Find out how to get care, treatment, and support if needed. We have to teach them, like if they are in a situation where they need a help, so how can they get a help, like telling them how they can call a ambulance, or how can they use a first aid box, or how can they help a person when he is suffering. So this will help them to find out how to get care, treatment, and support if needed. Help keep your school clean, safe, and welcoming for all. Yes, if the students keep the school clean, then it is safe and welcoming for all. We will all like when our students are helping us to keep our school clean. So this can be taught by us by taking some sessions. And the last one is become an influencer in local committee to make your school a better place to learn. Yes, if a child is taught in school to how to become an influencer and some good habits that he has learned, he can go and tell them or practice the same in his committee. That will help even the community, and he can become a good influencer, and this will also make our school a better place to learn. Now, in this circle, we can see it has been divided into four parts. The first is government. As I told you before also, that government plays an important role in making any policies. Now, like government makes a policies on health and well-being. For that, we need education about that. When we get the education about the same, then only we can help our community, right? So why is the need to invest in the health promoting school. So it is now it's a high time that we should start investing in the health promoting schools to reduce health risk factors affecting the school community, to reduce inequities in students' health and well-being, to establish behavior foundation for lifelong health and well-being, to prevent and mitigate negative impact of health crisis, example COVID-19, on education. See, COVID-19 has changed our whole education system. We have never thought that we will face this scenario in our life, but this has changed the whole of our education system. So we can prevent this by making every school a health promoting school, to improve school enrollment, academic performance, and educational achievements, to improve quality in educational outcomes, to decrease the burden of disease in children and adolescents, to increase workforce capacity, social capital, and social cohesion, to fulfill national commitments to equitable health and education and gender equality, to enhance community engagement in school operations, to promote healthier communities and community cohesion, to foster and sustain multi-sectoral collaboration for education, health, and well-being. Now, I'll show you a video.
We spend around 15,000 hours inside the school gates completing our primary and secondary education. Schools are our second homes. They are where we grow, learn, make friends, hope for the future, and try to fulfill our potential. Governments and schools should have policies and resources focusing on ensuring all students fulfill their right to quality education, health, and well-being. This means schools must be founded on principles of democracy, equity, and promote values and practices which prioritize health and well-being. School leaders should involve their students in decision-making. And teachers, parents, and community leaders should work together to promote the health and well-being of all students. Teachers should teach students life skills to help them make healthy choices, not only care about their grades. Schools must foster an atmosphere of friendship, understanding, tolerance, and empathy, where nobody gets ridiculed, excluded, threatened, or hurt because of differences in gender, ethnicity, family status, or exam scores. School environments must be safe and healthy, free from tobacco products, drugs, alcohol, and unhealthy food. They should have facilities for physical exercise, play, water, and sanitation. Students should have access to quality health services, including regular health checkups, psychological support, and mental health services. In summary, all schools should be health-promoting schools. When students are healthy, they learn better and have brighter futures. This vision is set out in the global standards on health-promoting schools, which call for a change from scattered, isolated.
So in this video, this was the summarization of the whole of the session has been done in this video. Now the last one, no education system is effective unless it promotes the health and well-being of its students, staff, and community. Do you agree with me, teachers? No education system is effective unless it promotes the health and well-being of students, staff, and community. After hearing this session, do you agree with me? Teachers, do you agree with this? No education system is effective unless it promotes the health and well-being of students, staff, and community. Okay. Alvin sir, yes. Shania, yes. Mervin. Okay. So we all agree with this that no education system is effective unless it promotes the health and well-being of students, staff, and community. These strong links have never been more visible and compelling than in the context of COVID-19 pandemic. Towards making every school a health promoting school, we should be inspired by the experiences of the others. Health and at last, health promoting schools are everyone's business. It is not an individual's business. It's everyone's business. This required multi-stakeholders engagement. Thank you, everyone.
Thank you, ma'am. Well done.
Thank you, sir.
Good session. Sandeep, very good session.
Thank you, sir.
Nice presentation also. Lot of things to be kept in mind. Very good.
Thank you, sir. Thank you, sir. Thank you, Mosmi ma'am. Thank you, Neeta ma'am. Thank you, Shania teacher. Thank you, Chaitali teacher. Thank you, Anita teacher. Thank you, Archana teacher. Thank you, Manmeet teacher. Thank you, Shalini. Thank you, Mohan sir. Thank you, Shukra teacher. Thank you, Anamita teacher. Thank you to Tumpa teacher. Thank you, Arun sir. Thank you.